Well, for more on curbing the spread of COVID-19, joining us on the program is Professor Adebola Olayinka. She's a clinical microbiologist and also currently coordinates Lassa fever research for the NCDC and is engaged by the World Health Organization. Thank you for joining us on the program. I must begin by asking that as a researcher into diseases outbreak in Nigeria, what are some of the things that you've noticed with the coronavirus, how it infects one person and then spreads to a community?
Good evening. It's important to mention the fact that coronavirus, well, we all know it's a new virus. The SARS-CoV-2 that's causing COVID-19 is a new virus, and not much is known about it. In fact, I normally joke that this virus is just about 4 months old compared to a lot of the other infectious pathogens that are hundreds or more year old. So one thing about the virus is it's a virus that causes a respiratory illness classically. But apart from the respiratory illness, it also causes what we call constitutional symptoms. And what do I mean by these? These are just general symptoms that are similar to what malaria causes: headache, fever, generalized body aches, weakness, and a loss of appetite, and so on. Now, the virus is such that it attacks primarily the respiratory system. And so what we call the portal of entry, that means the route by which it enters into the body is primarily through the respiratory tract. And regions of the body by which you could get the virus in the respiratory tract are the eyes, the nose, and the mouth. And that accounts for a lot of the preventive messages that is put out, like keeping the distance, because when you don't keep the distance, then you are likely to inhale the virus from somebody who is coughing it out or who is shedding the virus even through speaking. So it's not only people who cough who are able to shed the virus. If someone is positive and the person is talking, that person could actually be bringing out the virus. The other thing about the virus is it's transmitted very easily, it's transmitted very quickly, and it's actually been quicker than most of the other viruses that we've experienced in time past.
I was going to ask...
There are things that are effective against it, okay, and that includes alcohol.
Professor, might just quickly jump in here, and that is to ask about physical distancing, okay, if it's, you call it the same as social distancing, and then how much distance now? Is it 1 meter? Is it 2? Is it 3?
Okay, I'll call it physical or spatial distancing, not necessarily social. And that's because there are different social ways by which we interact without actually meeting. So the minimum is 1 meter. But we now say if you have to have contact with somebody who has symptoms, you want to increase that to 2 meters. But the minimum is 1 meter.
Professor, how would you say we're doing in terms of infection and prevention methods in Nigeria?
Could you come again? I didn't get that clearly.
Just to repeat the question,
I didn't get your question.
How would you say we're doing in terms of infection and prevention methods?
What I see is that it looks like a lot of people in the community are not really aware, or they don't understand what needs to be done in terms of prevention. A key thing to help us in terms of prevention of transmission is to keep that distance. And a lot of messages have gone out, but it looks like it hasn't reached really the people at the core of the community. If you go into many communities, yes, people do not go out, but they still mingle beyond their families. And what we expect is that stay within your family as much as possible. And if you need to meet someone outside your family, you need to keep at least that 1 meter distance between yourself and that person. But that message really hasn't gone in. If you go to our markets, you still see people clustering together. You see people, having meeting and keeping that close distance between each other rather than keeping that distance away. And that's a message that we need to understand going forward, especially when even the restrictions are lifted. It doesn't mean we do not keep some of those prevention messages because they're critical to handling the transmission of the virus.
Need to have more education and indeed more surveillance. But I must ask, in relation to other outbreaks or other infectious diseases, how are we doing? Have the numbers gone up because we're concentrating on COVID-19 or what?
Oh, well, recently we had a very bad outbreak of Lassa fever. The highest we've had so far in the country. And even though the COVID came up, it was still an outbreak that needed to be addressed. So it's not so much as in we're not focusing on the outbreak, but I think one thing also is Nigeria is used to handling multiple outbreaks at a time. So there was focus on Lassa fever. The numbers have gone down, which normally happens seasonally in the country, but we still have cases happening. And there are people who are still responding and treating those cases across the country.
All right, we appreciate your time. Professor Adebola Olayinka, thank you for joining us, a clinical microbiologist, currently coordinator Lassa fever research with the NCDC.